sometimes what's happening is that baby is crying a lot and it's telling us something is out of whack. And that's the only way it knows to tell us. And it's saying, take me to the chiropractor. But many people do not realize this and that they go eventually, if they eventually listen and they're like, that just really helped so much. That cured my baby of colic, and my baby's pooping better now.
Welcome back to the Midwifery Wisdom Podcast. We are so excited to be kicking off Season 5 with an incredible conversation between guest host Angie Love and Florida Chiropractor Dr. Jennifer Carter. Together, Angie and Dr. Jennifer talk about the benefits of chiropractic care during pregnancy and postpartum. Dr. Jennifer talks about how chiropractic care during pregnancy can aid in a smoother and faster delivery, beneficial for both mama and the midwife. Angie and Dr. Jennifer also talk a bit about External Cephalic version, ECV, a procedure used to turn breech babies. Additionally, Dr. Jennifer shares valuable advice on how day-to-day activities and habits impact your body and your baby's position during pregnancy. Let's dive in to gain a deeper understanding of how chiropractic care can enhance your prenatal and infant care routines.
Hello, beloved community. This is Angie Love here today on the podcast, and I have a very special guest with me today, someone who has been near and dear to my heart for many, many years. Her name is Dr. Jennifer Carter, a local chiropractic care provider who I refer all of my clients to go to for multiple reasons, which we will get into. So, Dr. Carter, do you want to introduce yourself a little bit?
Hi, my name's Dr. Carter. I own Orchid Island Chiropractic. I have offices in Vero and Sebastian Beach, or Vero Beach and Sebastian, Florida. And I've been practicing for 14 years now. And I would say 11 of those years I've been doing pediatric and prenatal care. And I've been working with Angie for 11 of those years. So yeah, it's been a great experience.
Yay. And I first met Dr. Carter because we were neighbors. She lived on the same street that I was living on. And I was pregnant at the time. And it was so nice to have a chiropractor on the street. And she adjusted me. I'm like, oh, she is good. And so that child right now is 9.5 years old, almost 10. Yeah. My little Zoe.
Yeah. Isn't it nuts to think how big they were so little when we were together, and now they're all so grown up?
They really are. Yeah. So for those of you listening to the podcast who haven't heard of me, Angie Love, I am a nurse midwife, and I do community birth in Florida, at a little town called Vero Beach. And I have been practicing midwife for 20 years now, all of it in community birth, first at a birth center and now at doing home birth for a long time. I also have a telehealth business called Midwifery RX, and we are trying to get that open nationwide. It's currently in 23 states, and it is providing medications and consults with CNM midwives all over the country. A lot of it is to help community birth be safer by helping patients planning home births, getting medications they need. But then a lot of other part is providing medications to pregnant and lactating people who other people don't want to touch. Because we have that as a problem sometimes. Sometimes in pregnancy, someone's got real bad depression and they need some medication and no one wants to give it to them. So anywho, that's kind of like my backstory. Dr. Carter, you want to talk about what got you started in becoming a chiropractor? What got you interested in your path?
Yeah. So when I always knew I wanted to be in healthcare. And so it was really troubling when I kind of got done with my undergrad. Did I want to go into nursing, med school, PA school? And I really struggled kind of finding which program would facilitate what I wanted and what would work best with me. And I actually had a chiropractor say, have you ever considered chiropractic? And I said, no, I don't even know what it is really. And when I went to his office and toured his office and shadowed him for the day, I was shocked at just how loving all the people were and what a hands-on approach to medicine and taking care of people. It wasn't cold. It wasn't sterile. Like, people were just genuinely happy to be there, happy to interact with the providers. And that was what was so enticing to me, was that people wanted to come for care. People wanted to be with their providers. People were just smiling and so thankful for the care that was given. And I said, I think this is my path. I think this is what I want to do, where I feel like I'm really helping people and I can feel the love and the joy coming back from people as you're helping them. So I said, let's apply to chiropractic school. So
yes, thank God you did.
I know. And it was such a need in our community. So it's really great to kind of be back here in this small town and kind of give back to so many women.
Yeah. Where did you go to chiropractic school at?
So I went to chiropractic school at Palmer College in Port Orange, Florida. So it's just south of Daytona. So I did my undergrad at UCF, which is in Orlando. So go Knights. So yeah, I'm a Florida girl. So I don't like to leave the sunshine. I like to stay right here. I have a lot of sand in my toes. So we don't do cold weather often unless we have to. But yeah, I was very fortunate that I didn't have to go too far away for chiropractic school.
Nice. And how long is chiropractic school?
So it is 3.5 years. So we take almost all the same courses that you would do for pre-med. The only course that we don't take is pharmacology. So since we don't do pharmaceuticals, we don't have to take pharmacology. But we do take extra time in differential diagnosing. So we spend quite a bit of time there. But most of the courses are very, very similar. And just kind of the differences is the hours that they log, doing some other procedures, more stitches and things like that. We do more on manipulation. But book-wise, a lot of it is exactly the same. Clinical-wise, there's some differences.
Yeah.
Yeah, 3.5 years. So it was 7.5 years total for school. It was quite the journey, but it was a good journey.
Okay. Beautiful. And are there prerequisites, like you have to do certain majors to get into chiropractic school for undergrad?
You don't. You could have basically any degree, but there are going to be some prereqs that are going to follow your typical medical program. So if you're a bio, health sciences, it's going to have your anatomies and physiologies. So it would be really hard if you were an education major that decided to switch into chiropractic. You'd have a lot of prereqs. But if you have a general health background into your undergrad, the transition is fairly easy.
Okay. Well, I first got introduced to chiropractic care down in Miami when I was working at the birth center there. And it was kind of just built into the birth center that the chiropractor came every Tuesday, I believe. And everyone, came in for the adjustments. He adjusted all the staff and adjusted the babies. And so I had never really been introduced to it. I'm like, oh, this feels good. So it was really amazing, just the effects that it felt in my body as far as back pain, neck pain, just really like teaching me like, oh, this is the norm of how loose and open my body should feel. So it was, after that, I knew, okay, I have a neck ache, I have a backache. It's time to go to the chiropractor. Like in my life, like this is the person that you go to. And I saw the effects also it had on labor, on women having easier labors, on helping babies to find a good position for birth, and really helping to adjust women who had breech babies or malpresented babies and them finding more room in their bodies so their babies could make the turn to head down. I came as a firm believer long before I moved here to Vero Beach and MedGen, and I had gone to different chiropractors, but I think just like midwifery, there is the science part you learn in school, but then there is also the art of how you actually do it. And so you can teach the science part all you want. The art you can teach and learn and model from other people, but there is a variety of practitioners, and you are the best one that I've ever gone to.
Oh, well, thank you. That's so sweet of you. But I would equally agree there's an art form to it. And, early on, you're putting your hands on bodies and you're trying to figure things out, just like with any medical profession. You just kind of are figuring it out as you go and you go through school. But it comes with years of practice and experience, and you kind of learn along the way. Sometimes I find myself that I didn't realize something until I'm explaining it to either a patient or a younger associate. And I'm like, oh, wow, I guess I never thought about that because, I was just doing it for so long that way until I explained it. And I'm like, no, I guess that's right. We do that. So, but it's really the art form, and we all kind of find our own technique and our own little twist on things to kind of make things work as best as we can for the patient. Because, at the end, that's what I'm really, I want them to have a great delivery. I want them to have the most optimal birth possible, or, help them postpartum. So we're always looking to really just make things easier for them. And if I can do that, then I'm like, okay, I did a good job. I made something a little bit easier on such a challenging step of life.
Yes. And tell me a little bit about your journey, about how you got interested in doing prenatal adjustments and baby adjustments, newborns.
So actually, a lot of that comes from you. So when we were neighbors, and I think you were pregnant and I had just had my son, and I think you and Linda Roberts and a few others in town really helped me work through his lip tie and tongue tie. And at the time, being here in this community, everybody told me I had to drive to Stewart or, to see certain providers. And I'm like, how is there nobody in this whole county that can help me with a toddler and a newborn? And I think you told me, you said, why don't you go back and do that? And I was like, I have a new baby that's so challenging in itself. I can't even think about more school at this time. And so I think when he got a little bit older, that's when I said, you know what? This is a real need in our community. Like, people can't drive 45 minutes with a newborn baby. Like, that's ridiculous. So that's when I went back to school and I did what we call the ICPA program. And so that's training in prenatal care and pediatric care. And so with my toddler and my new baby, we made a lot of trips to Daytona. We did a lot of weekend seminars, and we got certified with ICPA, learning a lot of their techniques. So that way I was able to come back to Bureau and really help a lot of moms that way, because I just felt like it was such a need. I needed it that bad. I can only imagine the other people that needed it. But yeah, a lot of that goes to you, Angie. You were the one that gave me the push, put the idea in my head, and I said, I can do this. We had to get through this few sleepless months, but once we got past that, I was like, all right, I can make this work.
Yes. And so for those listeners who may not realize the importance of chiropractic care, is if a baby has a tongue tie or a lip tie, it's considered a midline defect, in which the midline's really tight. And it's not something that's just a problem after birth. The baby has been sucking with this little tight mouth in utero for months. And so there's muscle memory that's involved. And sometimes the position in the utero can make it worse, where the baby's head is tilted to one side or the other. And so it's recommended when you have that tongue tie release is that you start also doing body work. People do body work before it, after work, but you need to do some body work to release all of those muscles. And a lot of breastfeeding issues can be helped with chiropractic care. Sometimes you'll have moms that say, well, the baby latches great on my left breast, but not on my right. And it's because the baby's got a kink on the neck, that a trip or two to the chiropractor will help solve that problem.
And it's really amazing the earlier we see that and how much easier it makes it on moms. So the faster we see baby and we can adjust that little bit, it just saves everybody so many visits, so many steps. It's just such a preventative measure to get the adjustment early on and catch that. And a lot of times it's hard because when you're either a new mom or first time nursing mom, you're not sure what it's supposed to feel like, or if that is normal or what's not normal. So you're thinking, okay, well, we're doing okay. But as weeks go by, we start to realize how hard it is. And, it's getting a little more painful, or that side's getting more challenging. And that's when, normally the problems arise and you can kind of really see it. But if we catch it from the beginning, it just saves everybody so much headache.
It really, really does. And I mean, you can see in nursing moms when they come in my office, sometimes it'll just be like they already have the hunch back over because you're just so used to like leaning over for their baby. And oh, they're complaining of the neck ache and the shoulders and all this. I'm like, well, we got to work on your positioning, and you may need to go to the chiropractor to get that back in alignment.
I tell all my new associates, I said, you will see all of our pregnant women, low back pain, low back pain, low back pain. 2 weeks postpartum, they're in our office for neck and upper back pain from all of the nursing and the holding and the baby. I said, it's almost always upper back week. Week 2, they're here saying, oh, my back hurts. They have no core muscles left. You know, all they're doing is nursing and holding a baby. And, you know, it just really takes a toll on their neck and their upper back. So
you want to walk us through what a typical adjustment with you looks like for an adult, and then we can change it up and do it for a newborn?
Yeah. So for a pregnant patient coming in, typically we kind of just run through your general history of, you know, just basic traumas, accidents, surgeries, all the information. And then I kind of take the model and I kind of explain things that are different. A lot of people have been to the chiropractor, but then when they come to me, a lot of things I do are different. So I like to point out the anatomy of what I'm working with, because I work a lot more with the pelvis. And with me working with the pelvis, I'm pushing in a lot of areas that probably their previous chiropractor has never worked on. So I like to first point all those spots out, so that way we're not shocking anyone and everyone's aware of where my hand placement is going to be to help mobilize the hips and the SI joints. Then normally after we kind of walk through it all, then I'll have them lay on the table. I do most of my work. We have these big pregnancy cushions that the patients get to lay into, so they're able to lay face down for the first time in weeks, typically. Then we'll use the drop table. So I typically use my table, which is very light force, and the drops go up and down. So it's just little pushes on their hips and pelvis. It makes a loud noise, but it's very gentle, baby safe, and tucked into the pillows. So we'll kind of work through the back side of the pelvis. We'll go up the spine. Then I normally have patient turn over, and then we start with the pubic bone, and then we work our way back up. So we'll work with the pubic bone, the hip flexors into the neck, and we'll go from there. But so it's really very, very gentle, not an aggressive adjustment at all. It's mostly light pushing and stretching. So I find most of my work is really in the hip flexors, and that tends to be the most tender spot for most patients, but it's the most effective for keeping the pelvis in alignment. That's kind of how I would do my basic prenatal adjustment. So.
And ideally for you, when should people start coming to see the chiropractor when they're pregnant?
I typically say if they have no history of accidents or traumas, overall generally healthy, I like to see them around 20 weeks. I think that's when I tend to see most of my patients. Say 24 is when the relaxin gets going, 24 weeks, and people tend to trickle in by 24. They're saying, oh, this hurts, that hurts. So if I could see you about 20 weeks before the aches and pains start, even better. But most people tend to make it in around the 20 to 24 week mark. And then I typically tell them to follow whatever they're doing with their OB. So if they're with, you and you're seeing them once a month, then that's when I say for them to follow up with me once a month. When you move them to twice a week, then they move them to twice a week. When you move them to once a week, then they move to once a week with me. So it's really, based on their care. I think in coordination with us working together as a team, we just get a much better end result, and we stay together, and the communication is very clear from both providers to mom, keeping everybody on the right path.
And what does a typical newborn adjustment look like?
Newborn adjustment looks like I am just snuggling your cute baby. So there is very, very light force. So most of it, I will put them in a pillow. So I have this cute little pillow I put them in, and I kind of just mobilize their hip joints, get them to turn their head to the right, turn their head to the left. Most of it's very passive, trying to see what they can do on their own. After I'm done with that, then I'm going to hold them in my hands, and I kind of just look like I'm just playing with your new baby. So we just gently bend them to the right, bend them to the left. We're really just checking for mobilization and trying to find those restrictions. Typically at this point, this is when we'll see maybe a baby doesn't like to turn their head so much to the right, or they don't like to turn their head so much to the left. And depending on baby and how old they are, most of the time it is used with my hands, and it's just my pinkies, and it's the amount of pressure you would put on your eyelid. That's as much pressure as I'm putting on their spine. So it is so gentle. There's no pops. There's no cracks. People are like, I can't believe you're going to crack a baby. That's not what it is like at all. It's very, very gentle, and it literally looks like I'm just playing with them. I'll give the baby back, and they'll say, that's it. And I said, that's it. It's just mostly mobilization. There's so much cartilage on babies that the amount of force that I have to use is just with my tiny pinky and very, very gently.
Beautiful.
I was going to say, and sometimes depending on the complaint, I will check for the tongue tie and the lip. But if that's the complaint, if someone's nursing complaints, we'll also go down that path.
Yeah. And from my experience, the chiropractic can help with that nursing position, being able to do both sides, being open to open wider in the mouth to get a deeper latch. It can also help if there's a fussy baby or a colicky baby. Sometimes what's happening is that baby is crying a lot and it's telling us something is out of whack. And that's the only way it knows to tell us. And it's saying, take me to the chiropractor. But many people do not realize this and that they go eventually, if they eventually listen and they're like, that just really helped so much. That cured my baby of colic. My baby's pooping better now.
Yeah, it's so true. I always say, people say, what should I expect afterwards? And I said, typically, we're going to see a big poop from baby right afterwards. And we might see baby will be asleep a little bit longer, which some moms, it's scary because you're like, oh no, she broke the baby. Why is the baby sleeping this long? We didn't break the baby, but we really stimulate that parasympathetic nervous system, which is, the wine and dine. And then they're relaxed and they get, an extra 30 minutes, which feels great. As long as we're not fussing and worrying, why are they sleeping too much? But almost always we get a nice big bowel movement. And that's just, again, part of that wine and dine, stimulating the parasympathetic nervous system, helping baby. So those are the two things I tell parents to look for post-adjustment.
Yay. And then I know we have a special induction you do to help nudge people into labor sometimes. What does that look like?
So it's very much similar to the same adjustment, but I focus more of my attention onto the lower sacral base. Those are the sacral nerves, the S1, 2, 3 nerves. That's part of the parasympathetic nervous system. Same with the upper cervical, all the way at the base of the skull, the first vertebrae. That's also part of the parasympathetic nervous system. So if I work with those two areas, that also stimulates the wine and dine. So a lot of times when we're at the end and we're really ready to have baby, we're anxious. Everybody's calling and texting. Or do you have the baby? Are you in labor? And it's kind of puts you in that fight or flight mode. And it's just a lot of anxiety. So I really try to stimulate the calming areas, more of that wine and dine, rest and digest. And by stimulating those areas, it kind of lets baby know we're cool. We can be delivered today. It's all good. Everything's fine. But by stimulating the wine and dine, the parasympathetics, and turning off that fight or flight, that seems to really help moms go into labor.
Yeah.
So I say that a lot. I'm always trying to turn on the wine and dine. We want to get those parasympathetics firing, and that will really help. We'll also sometimes do a sacral base technique where we really kind of just stretch down the sacrum and put some pressure back there. Again, it's helping with the pressure, the pelvic pressure, and just releasing those parasympathetic endorphins to kind of get you to go into labor.
Yeah. And I can tell you that on occasion, Dr. Carter has come out to a labor and adjusted a mom who has really intense back pain or maybe is stalling out at a certain centimeter and not progressing more. One time I remember was quite traumatic. This client of mine was her second baby and her first had, gone pretty well. And here she was with her second kind of stalling out around 6 centimeters, not progressing quickly, a lot of back pain. And she was like, I think I might need to go to the hospital. Like, this really hurts. And I said, well, let's call Dr. Carter. So we called Dr. Carter, who came out, and she did her magic adjustment. And then within 30 minutes, that baby was out. It was just like magic.
I remember that. I hadn't even got back into bed yet. And you called me and told me. That was fast.
Yes, it was so beautiful and amazing. And so that is definitely going above and beyond the call of duty.
I just love being able to help. And it means so much to have the birth that they want and to be able to really follow their birth plan and not have to go to the hospital or not have a C-section. I think that's just so amazing that I'm able to help provide that opportunity for someone whose path may not go that way if they, if I wasn't there to help, at least try. So I'm always up to try.
Yeah, I would say that everyone who comes to you loves you. You are very beloved in this community.
Thank you. It's equally for you. There's mutual love for you in this community.
We have a great story today to report in that I do versions, ECVs, external cephalic versions. Some of them are for my clients who are already planning a birth with me, and they have a breech baby that we're going to try to turn externally. And some of them are from all over the state of Florida. Somehow they've heard about me, and they're driving 3 hours to get an adjustment. And so I normally have them stop to see Dr. Carter in the morning to get their wonderful massive adjustment. Usually takes over an hour, and then they come to my office and we do all the things to try to get their baby turned. My recent statistic is 83% successful. So that's pretty exciting. But today we had one. She had already been to 2 other chiropractors during her pregnancy, and she went to you and said there were things that you did that no one else did, and she felt your adjustment was so amazing and beautiful.
Well, she was really sweet, and I was so happy to hear the outcome. So it was, it's great when, I get the feedback. A lot of times, we do work with patients, and then they go into their different offices and, I don't know, did baby turn? Did they have a C-section? So that's the great thing about working with you is that, we're always communicating with each other and, oh, that was great. This worked there, so it's really amazing on that aspect of, knowing what's working, what's not working. Like, okay, that was a positive experience for that person. And, we just changed someone's whole birth today. So it's just so cool to say that that's what we did.
Yes. And ideally, that would be wonderful to be getting feedback from everyone that you're adjusting. You know what I mean? Because in an ideal world, it's good to hear, well, let's improve. There's always room for improvement. So some of the people that I've sent to you to get adjusted, when they show up at my office, their baby's already head down just from your adjustment. You did your magic. And I'm like, okay, well, I don't even have to do anything. That was great. Thanks for driving 3 hours.
That is true. There's been a few, but no, it's super cool to see when it happens like that. So, but, the teamwork, I think, is what really, you're so confident in me, which is just amazing when they come in. I'm like, you drove from where to get adjusted by me? And they're like, but Angie said I have to come to you. And I said, okay, we'll make it work. But I'm just, sometimes it blows me away that I can't believe someone's, from that far away. But I'm like, we do great work together. And now I'm like, all right, let's make good things happen today. So.
Yeah. And I think you're getting the feedback because they're trying other chiropractors and finding that you are very excellent at what you do. And just to let you know, Dr. Carter is not the tallest human. How tall are you, Dr. Carter?
No, I am 5 3/4. I pushed for that one, so I'm pretty petite.
She is petite, but powerful and gentle, all wrapped into a mighty little package.
We make it work.
This episode is brought to you by Lawdor Bookkeeping, a virtual bookkeeping firm supporting midwives and doulas. We understand that what you love to do is serve mamas. So while we focus on managing your books, you can focus on client care. By keeping your books clean and tidy, we can help you make confident money moves, pay yourself a consistent salary, proactively save for taxes, and plan for growth. Learn more about working with us by clicking the link in the show notes.
So today's version was beautiful. There were a lot of nerves. There was a lot of anxiety in the room. Some people are very smart, and so they've gone out and read all of the internet and all of the research and gone down all the rabbit holes. And so that was like the vibe. And I like to do my versions. I like to put on like relaxing music, like we're in a spa, and use some nice oil and, do this for a while and just give the baby a nice massage and speak to the baby and offer the family if they want to say a prayer and, all the nice things. So, and obviously I'm using an ultrasound to verify position, and we're checking vitals and Doppler, all that stuff too. And so we did that today. And when we started, the baby was LSA. So the baby was head down, head up, butt down, and hanging out on mom's left side. And then we do some of the rebozo. And then we did a knee chest inversion for 15 minutes. And then when she turned around from that, baby was transverse. So then we have our left-sided head up by her ribs, and then the butt up in the right-hand ribs, right? That was just from some knee chest. Baby kind of turned halfway on its own. Fabulous. So then we do our prayer. I lube her up. I'm just doing a light massage, kind of like just light Mayan abdominal massage, right? All of a sudden, she starts getting really nauseous, which I think is, due to the medication that I've given her to relax her uterus. So we turn her to her right side, have a bucket nearby. We're giving her ginger lozenge and an ice pack and just, relax. Oh, maybe 10 minutes. Then she turns back and baby was head down.
Amazing. That'd be the best.
Yes. So, it was beautiful. The ancestors were there, and it was a very, happy moment for everyone in the room, and everyone could just release that worry.
Yeah.
And then after the versions, we like to bind the belly and make the abs nice and tight again, and then have her do a ton of exercises around the office to get that baby's head nice and low. And she might wear that binder for the next 2 weeks until she feels baby's head nice and low.
Yeah. So how do you decide when you are going to bind them versus when you bind with the towels? Like sometimes I know you'll bind a little bit higher versus just a lower bind. Is it based on how far baby's head's down, or how do you make that decision?
So I always usually use the towels that day and then tell them to wear those towels until they take a shower the next day. And then after that, just use plain binding.
Okay.
But I usually leave a little bit of room at the bottom, maybe like 4 centimeters above their pubic bone, so the baby can have like some wiggle room to turn their head as they need to get into the pelvis. But then above that 4 centimeters, I want to bind everything nice and tight so the baby doesn't turn back around. It's less common in first-timers to turn back around, but it's more common the more babies you have. That uterus is a little roomier and stretchier. And so we're providing like the abs that maybe that mom doesn't have as much anymore.
Okay.
Until she feels baby nice and low.
Yeah.
Yeah.
And when is a typical week for you that you like to do your ECVs?
So ideally in a first-time mom, sometime 35, 36 weeks. Because we know first-time moms, their babies get engaged sooner into the pelvis. That's just natural. Like normally by 37 weeks, they're all engaged. And once that head gets low in the pelvis, it's very, very hard to get it out. Or I mean that butt, sorry. We're talking about butts. So once that butt gets down in there, it's hard to get baby out of there. So my success rate has been higher when we do them at 35 or 36 weeks for the first timer. For the second timer, I would say 36, 37 weeks. Okay. Second timer or more. And I know that's different than a lot of times what they do at the hospital versions. Sometimes they'll do a hospital version at 37, but a lot of people will get a hospital version at 39.
Yeah.
With the idea that, well, if it works, great, we'll induce you. And if it doesn't work, we'll just go back for C-section. And so it's kind of like it doesn't really matter.
I agree.
as much. And if it works, great. And if it doesn't, great. But like by that time, a lot of babies are engaged and it just makes it so much harder. And they're bigger. They're bigger and more engaged.
Yeah, I would find that it seems harder the further, once we go past that 37 marker, when you're in the 30 to 39, it's a lot harder.
Yeah.
Movement wise, everything doesn't move as well. So,
yeah, I'll still try. So if they really want to try, I'll still try with them. But if they know about it ahead of time, earlier is better.
I would definitely agree. I find earlier to be much easier and much more successful. The rates of baby turning typically is much better the sooner we see them. But.
Yeah. And I try to keep statistics on all of my outcomes. When people are reading up about versions and the risks, they can sound quite scary, obviously. They say the risk of something really extreme happening that would require immediate delivery is like 1 in 200. It's like 0.5%. I have not done 200 versions, but I have never had anyone have that kind of event where we had to go to the hospital. Probably the worst thing that happened after one of my versions is someone's water broke 3 days later, So was it related to the version? Probably. Do we know that for sure? No. But, that's the worst thing that's happened, knock on wood. But I think that because we have moms that are not medicated and don't have epidurals, I also have a lot of feedback from the mom, like, I need a break, or that's too much pressure, So I would say it's a more gentle version that we give more time for. We're not trying to just say, oh, you got 10 minutes, and if baby doesn't turn out well, I'll work with them up to an hour if baby's heart rate's sounding good for the version.
That's good. It's good to know. I know. I was just speaking with one of our doulas today, and someone that both you and I work with regularly, and we were saying how as much as we work together, you haven't been with me while I've done, a full breech protocol, where I've never seen you do an ECV. And for her as the doula, she said, I've seen Angie's work, but I've never seen your work. So it was just kind of cool to see it all coming together and all of us, getting to watch what each one does when we go through this journey as a team, trying to really prepare the patients, which I was like, you know what, I'm going to have to get over to Angela's and see that. But it's really just fascinating to me how it all ties together.
Yes. And it's so beautiful, and it's so people are crying and thanking us. And I try to pass that back onto you, that, that feedback when I get it. And then I also try to keep in touch with the moms to see how their birth went, one way or the other, to hear how are these babies doing, and did they go all the way to term? Did they go to 41 weeks, 42 weeks? I'm a nerd, so I keep an Excel spreadsheet.
I love that.
My nerdy self. Yeah. So what would you say? I know as far as home birth, there's some people that are afraid, like, is home birth safe? Right? That's a lot of people thinking, is that something safe to do? There's actually one of my fellow community birthers, Nathan Riley, just had a podcast on the safety of home birth, which I can link to in these notes, and reviewed a lot of statistics. But I know some people have concerns about that with chiropractor, like they're worried, is this safe? So I just wanted to give you a moment, like, speak to that. What do you say to that?
I'd say everything we're doing is completely safe. So we are not engaging with baby. Everything I am doing, I'm working on your pelvis. So I'm working on the bones of your back. I'm working on your tailbone. So we don't put our hands on your belly, so to speak. We're working with the hip. I'm, working everywhere around your belly. My job is to keep your belly as safe and as tucked into the cushions and the pillows and in a neutral position. As cute as the bellies all are, I'm looking at SI joints. I'm looking at pubic bones. I'm looking, at the muscles of your back, which if they're pulling to the left or to the right. So baby is always the number one safety priority, but we're always keeping our hands basically away from baby. So our goal is really to try to mobilize the rest of your body because of the distribution of the weight from the belly. So a lot of times, as you know, your belly grows, you're changing your gait, you're changing the way you're holding your body just because of the weight distribution. So as your breasts are getting bigger, as your belly's getting bigger, a lot of times we don't even realize that you're changing the way you're tilting your hips, or you're standing on your right and not as much on your left, as your feet are starting to swell. So there's a lot of changes in other parts of your anatomy. So when we are adjusting, we're looking at all of those things. The belly is just the cute accent part for us. So our job is to really just kind of keep baby nice and tucked in and safe, but we stay away from baby. So that's all for the midwives and the OBs to do baby. We do all the areas around the baby. So, and a lot of people will tell me, I'm afraid of my neck. I don't want my neck adjusted. And I say that's completely fine. So a lot of times people think like, if I go to the chiropractor, they're going to want to adjust my neck. And that is not the case. So we can still adjust your pelvis, get your hips in alignment, get everything situated, and we don't have to adjust the neck. So I really like to stress that, because I know that's a big concern for women coming in and thinking that they have to, and they're already so nervous about getting adjusted being pregnant that they're more afraid of, getting their neck adjusted. And that's just not something that has to happen. So, and, just like with everything else in healthcare, I said, just advocate for yourself. Please say, that makes me nervous. That's uncomfortable. I don't like that. And every chiropractor will say, okay, we don't have to do that. We also have gentler techniques. We have the activator, we have the massage guns, we have some really light force techniques that we don't have to do. So it's not always the things you guys see on TikTok or YouTube, and, it's not the big cracks all the time. So there's plenty of other methods that make things very, very safe. But the key thing is just making sure that mom is comfortable, like that she feels good, she feels safe, she feels that her baby's safe. That's the biggest thing that I want everyone to feel when they're in our office, is that, you are in a safe place and we're here only to help and aid you. And anything that's uncomfortable, by all means, we don't have to do.
Yes. Well, thank you for bringing that up, because I know that some people do have those concerns. And I would say there's benefits to being more comfortable in pregnancy. Like you spoke about, just pregnancy is a strain on our bodies. And so keeping all of your ligaments and your bones in alignment are going to help you feel better. But then there's also big benefits for your labor, because our human pelvis is very interesting, and the shape of it requires the babies to make like 3 different turns to come out. And so labor and birth go better when everything is loose and open and limber, and baby has all the room it needs to figure out how to make those turns through the jigsaw puzzle that is the pelvis. So from life, we cross our legs on a certain way. We wear our heavy purses on a certain shoulder. We get into these habits hunched over our keyboards. And so our human bodies are not like they used to, where they were out, bringing in the crops and doing lots of physical labor that was balanced and sitting on the floor. Our human bodies are very different nowadays. And we have more sedentary lives. And so I feel like we carry these tensions and these imbalances throughout our lives. But in labor and birth, it becomes very apparent, because we have long, drawn-out labors when baby can't make the turns it needs to.
Yeah. And, a lot of times I'll ask my clients, like, what is your day-to-day? And they kind of look at me like, and I'm like, well, are you a waitress and you stand on one side of the table and you use one side of your body most of the day? Or are you a bank teller and you're over a keyboard all day? But it's really your ergonomics. It helps me to figure out where we need to work, what's going to be tight, what's going to be loose based on your day-to-day activities. Do you have a baby on your hip while you're pregnant? That really makes a big difference. And it wouldn't sound like that makes a big difference, but it really changes the way you're going to distribute the weight in your hips and which way we need to adjust to allow, baby to move. So those are sometimes the smallest details, but those are the biggest key information things that I ask and look for. Is tell me what you do all day. Are you, on the floor in a daycare, or are you, a dentist and you're curled over someone's neck? It really just depends what you're doing day to day. And it will help me adjust you better to get the most optimal adjustment to get baby in the right position.
Yeah. And so I feel like our body balancing and limbering, I mean, there's similar work that could be done doing yoga for hours every day, right? There's similar work that could be done doing spinning babies principles, which was designed with the help of a chiropractor to help balance the body. And I feel like the chiropractor is like the shortcut to all of them. I mean, ideally, we all did yoga for 3 hours every day and our body was naturally loose and open. But our society, we really don't do that. And we have kinks. And so going to the chiropractor is a shortcut. And I've had people that say, oh, I've had sciatica for years. They never dealt with it or dealt with anything with it. And then I tell them, you need to go to Jen. They see you and they're cured. Oh, my God, I should have gone to her 5 years ago.
It's true. It definitely is a shortcut, even though we do preach, just, still do those stretches, do some yoga. We want to do it, but society doesn't allow it. You're absolutely right. And so it's nice when you're like, okay, this is a quick fix for now, and we can try to continue to work better at different ways. But a lot of times people don't realize that they're so off balance or their instabilities or that their ergonomics are incorrect. So sometimes just coming here, we can help point them out to guide them and say, sitting this way isn't the best way to sit. You should try to sit this way, and this will help create that sciatica from going away. So it's a lot of correcting the imbalances, but it's hard to figure out on your own. So if you have someone to help you, it makes it a lot easier.
Yeah. I love how at the beginning of the visits, you're like measuring our leg length.
Yes. Always. We got to start with the leg length. So we got to see which way it's pulling from. But, as we balance everything and check everything, we use, a series of different measurements to check to make sure we're doing everything correct. So, and sometimes I'll say, oops, I forgot to check. Let me just double check. I always want to double check my work just to make sure, making sure things are pulling in the right way. And, even though I feel fairly confident, I still like to go back and double check.
Mm-hmm. Beautiful. And do you have any other comments about how your response has been since you decided to do prenatal and, baby chiropractic in this community?
I would say it's been amazing. I am blown away how many moms that we've been able to help in the community and how many referrals are from friends of other pregnant women that said, you have to go see Jen. You have to go make sure you get an adjustment. It's really amazing just to hear it from others, just that it's all word of mouth. There's very little marketing. Our community is so small to begin with, but to hear the feedback that their friends have sent them or other family members have sent them, that's just, to me, the highest compliment that, you want to send your sister to me, or you tell your cousin you have to go make sure you get an adjustment before, the babies do. It's really touchy. So I am really flattered when I get those family members or their good friends come in. But just the lack of other providers in the area. So it's really cool that I get to work with so many women because there's just such a shortage in our community. But in doing so, I've been able to connect with really amazing people like yourself, some of the people over at Healthy Start, just a lot of the other providers in the area that reach out and say, hey, can you help with this? Or, hey, I don't know, but you can try, Jen. I'm not sure if that's going to work, but try. So it's great to know that others in town are on board with, our prenatal care that we do at the office, and that they feel confident in our services and feel confidence in the safety that we provide here. I just, I do find it to be very touching and flattering that, people speak so highly of us. But it's, treat people right and do good work. I think that's kind of how it goes.
Yeah. Is there anyone that you would say should not get chiropractic care while they're pregnant? Is there any situations that you would really hesitate?
So typically I always, I kind of wait till they come back from their OB. So I always like to say, what did your OB or midwife say? How's everything looking? And they're like, well, if there's issues with the cord, if they have any type of like blood supply, cord supply, placenta issues, I tend to kind of not like to address them, especially in the first trimester. So I kind of really want to wait till we get past that 12 weeks, if that they know any of that type of information beforehand. And then it's very touch and go. And I like to monitor with their OB or midwife and just make sure, is it cleared with them? Did they say you're okay to come to the chiropractor? And typically it's always like, yeah, they said we're fine, we're good to go. But I am a little bit more reserved in the care in those first 12 weeks. It's along with some of our IVF babies, I like to wait until we get past those first 12 weeks as well before we start any manipulation. And again, it's just out of safety for everyone. I just want to make sure that, I don't think that it's anything chiropractic wise, but I also don't want anyone to wonder, was it the chiropractor? So I just, for the safety of everyone's peace of mind, mostly mine, I would like to just, I like to be a little more reserved and wait till we get into that second trimester for some of the more complicated moms. But, I find that our IVF babies, those are the ones that, kind of are more anxiety driven. And, I really like to keep everybody feeling very calm and knowing that everything is in a safe place. And, we've already worked so hard to get where we're at. So I tend to be a little bit more reserved with, the amount of force and the adjustment going into that.
Okay. How about anyone with like spinal issues, surgery, scoliosis? Are there different things you do for that?
So most of them, scoliosis, not so much. If there was, typically, I think you and I had a patient that had a previous injury, saddle fracture. And so I knew right when I saw her that I said, you're going to need more care than the average patient. You've had significant trauma to the pelvis, recovering from these injuries. Even though they were years prior, there was a lot of scar tissue, muscle memory, some other things that we had to work through. So when I hear of any type of significant spinal or structural trauma, I try to change my course of treatment a little bit more with them to allow for more manipulation as needed. So, and, I think that it worked out beautifully for that client. And, but I knew from the beginning when I heard the type of fracture and how she suffered the fracture, I was like, oh, we're going to work this a little bit different. But, we take each case into consideration. I try to always, evaluate what type of care needs to be given per the traumas. But yes, definitely, if there's any disc injuries, car accidents, we see a lot of disc injuries, but most of those can all be monitored through, regular adjustments. The big stuff, there's a few of those.
What do you do for like tailbone stuff?
So tailbone is the same adjustment. So we use a lot of the drop table and I use a lot of the activator. But most of our tailbone work, there is a ligament that goes from the bone you sit on, our sits bone, up to our tailbone. So the sacrotuberous ligament. And so I do a lot of work on that. And it's basically just some trigger point work. So you're really just kind of holding on those ligaments and manipulating the tailbone. But it's very light force. And it's just really almost like deep tissue massage on your bottom. So, but that's how we tend to relieve a lot of our tailbone pain. So, but again, it also depends how far either pre or post, and how much relaxin is in the body, because a lot of those ligaments are so loosey-goosey. I see a lot of my tailbone pain postpartum. So, that's hard when they're still so very loose. There's so much relaxin in the body, and we're trying to get them to kind of get things to pull back tight. So, but yeah, nice trigger point release on those will definitely help. But I also encourage a lot of pelvic floor work, postpartum when we start to see a lot of the tailbone pain. So depending on how soon it presents or how long it's going on, but the correlation of pelvic floor work with chiropractic has just been another amazing conjunction of combining therapies together. So the results are outstanding.
Yes. Well, thank you so much for coming on here today. I think that most midwives around the country have realized the amazing work the chiropractors are doing. If you are a midwife out there and have not realized that, you need to reach out and find the best chiropractor around you, because it's going to make your life easier. It's going to make the labor shorter. It's going to be having the women have less back pain. So all of those things make a midwife's job much easier and fewer breech babies. So I highly recommend chiropractors. I think that they're naturally tuning in to help the body function the best. And so midwives are also trying to support that physiological birth of just allowing the body to do its work. So it's kind of like a no-brainer for, midwives to be working with chiropractors.
I would definitely say if anybody is interested, there is a great website, icpa.com. They have a search box in there. You can put in your zip code and it will pull up chiropractors that are Webster certified, which is the prenatal certification that we get. So anybody that is Webster certified within your area. So it's a great tool to just try to find someone local, and you can kind of start in that direction. But ICPA is a phenomenal website organization for prenatal care for chiropractors.
Thank you so much. We'll put that link in the notes, and we'll also put Dr. Carter's information in the notes. And I just want to thank all of y'all for listening, and I wish you many smooth butter births. That's where the baby just slides on out easy.